Good afternoon, sir. My audible, sir? आवाज आ रही है मेरी?
Yes, sir. Good afternoon.
जी सर, नमस्कार सर. सर मैं ये कह रहा था कि स्क्रीन आप शेयर कर दीजिए अभी, उसके बाद हम फिर चालू करते हैं सर. सर इसको फुल स्क्रीन अगर हो पाए संभव तो इसको फुल स्क्रीन कर देते हैं.
हो गया सर फुल स्क्रीन?
जी सर, बहुत बहुत धन्यवाद सर.
Okay, thank you.
Very good afternoon to respected dignitaries, governing body members of RAV, Director RAV Dr. Vandana Siroha ma'am, Gurujans. I welcome you all in another intellectual session of Gyan Ganga webinar series. Today's guest speaker is Dr. Sanjay M. KADLAMITTI, Professor Kaya Chikitsa, Hospital Administrator, BLDEA, AVS Ayurveda Mahavidyalaya, Karnataka, who has joined us today in 2 to 5th episode of this knowledge voyage. I, Dr. Mridul, on behalf of RAV, welcome you all for today's session. On the onset, we would like to express our heartfelt gratitude and welcome our mentors who have always been there to guide, motivate, and encourage us for sustenance of this series. Respected Vaid Shri Devendra Trigunaji, President of Governing Body RAV. Respected Vaid Shri Rajesh Kotecha Sir, Secretary Ministry of Ayush. Respected Dr. Vandana Siroha Ma'am, Director RAV. Let us begin the session by seeking the blessings of Bhagwan Dhanvantri. Now, I would like to introduce today's expert, Professor Dr. Sanjay M. KADLAMITTI, who is going to throw light on the topic management of geriatric disorders in Ayurveda. Now, I feel privileged to welcome Dr. Sanjay M. KADLAMITTI, sir, a distinguished scholar and clinician in the field of Ayurveda. He holds MD, PGDYN, and PhD from the renowned Gujarat Ayurveda University, Jamnagar, where he completed the first ever PhD thesis in Ayurveda on osteoporosis. With over 18 years of academic, clinical, and administrative experience, he presently serves as Professor of Kaya Chikitsa and Hospital Administrator at BLDEA AVS Ayurveda Mahavidyalaya, Vijaypur, Karnataka. Dr. KADLAMITTI has contributed immensely through 25 research publications, 124 invited lectures, and multiple national and international recognitions, including the Adhyapak Bhushan Best Teacher Award 2024. His dedicated work in Ayurveda, especially in Kaya Chikitsa and osteoporosis research, continues to inspire students and practitioners alike. And now I would like to invite sir to proceed with the lecture, but I request all the participants to kindly switch off their mic and cameras. Thank you so much, sir. You can proceed.
Okay, thank you very much. Namaste, everyone. First of all, I thank all the distinguished dignitaries of RAV for giving me this opportunity to share my opinion and experience regarding the management of geriatric disorders in Ayurveda. So this is a spontaneous and inevitable law of nature. We all know that starting from the green circle, that is birth, growth, degeneration, and death. This is for everyone. All creatures on this universe has to undergo these procedures. So those who are born has to go all these stages, and the quest for finding the answer or remedy for aging has been observed since the inception of mankind. The very intention of Charak Samhita was Dirgham Jiviti Adhyaya. And Vyadeste, that means when the entire creatures were suffering from Vignabhuta Idaroga Pradurbhuta Shadirinam, there was the first international conference at the base of the Himalayas. I call it as the first international conference of Ayurveda at the base of the Himalayas, where Rishi Munis have came from all over the world to find the answer for the suffering of the all creatures of this universe. And then we all know the story that Bharadwaja himself came up that I will go to Indra and learn. That's why Dirgham Jivitiya, and also we can call it as we all age, we know that. Obviously, we all age, but our dream is healthy aging. We don't want to be dependent on anybody else. We have to be healthy, fit, and fine during the aging so that we can be enjoying the last stages of our life, being healthy, happy, cheerful, and prosperous. So we all know the Ashtangas. In that, the seventh one is Jara, Kaya Bala, Gahurdanga, Shaledamsha Jara Vishayi. And some 15 years back, I saw that on the Wikipedia, I was searching about the word geriatrics, and there was unfortunately some American scientist or American doctor who had been given the credit for finding out the word geriatrics from the word geria. Then I edited it. I edited it and I was in KLE Belgaum working like more 10 years back. I said that geria comes from the word jara because jara, geria, geriatrics, all same because Sanskrit is the mother of all the languages and it was well established and well appreciated. But somehow they took it out and they asked for the reference for all these things, which unfortunately is a monopolized way of learning knowledge. But still, we, the people of Ayurveda, should appreciate that Sanskrit is the mother of all the languages. The geriatrics has definitely come from the word jara. Jara is geria, geria is geriatrics. And there it is the gradual degeneration of the human body. And this branch of Ayurveda deals with Rasayana, also yet Jara Vyadhi Nashanam. It means disease of the elderly. This can be compared with geriatrics, which is the modern way of learning this geriatrics. And the 21st century is witnessing a very gradual increase in the life expectancy because of invention of life-saving drugs. If you see the life expectancy at the time of independence, it is documented in place that it was average was about 48 to 50 because of all these pandemic disorders, etc. The quality of living was not that great. But obviously, we had a very good quality of life during the Satya Yuga, Dwapara Yuga, and Kali Yuga, so in Treta Yuga. But now, after independence, as gradually India is growing into a developed nation, we have invented so much of life-saving drugs as well as the lifestyle habituate, clean drinking water, good food, etc. And urban style of living, of course, has done both because there are pros and cons. But obviously, and an average, the life expectancy of human beings is gradually increasing. I don't say that technology is increasing, but technology is also bringing the diseases. We all know that NCDs and all are there. But compared to only I'm talking about the life expectancy is gradually increasing. Hence, the number of elderly people are also increasing. On the other hand, because of the faulty dietary habits and sedentary lifestyle is also increasing. And this may be termed as the main culprit for increasing the geriatric disorders. If we see the demographic data, by the year 2050, adults older than 65 years will comprise one-fifth of the global population. I am talking about the whole world. And in India, 3.8% of the population are already older than 65 years of age. And according to the estimate, we already passed this 2016, it was 113 million. And look at another demographics from 2019 to 2050, the highest is Southeast Asia. East and Southeast Asia, number of persons aged 45 and over is 260, and by 2050 it will be 120. Whereas if number of persons aged 65 in 2050 will be 572, and this is a percentage increase that is 120. Everywhere it is happening. So WHO says there are 20 major cause of mortality in older people. And the major culprit is IHDs, stroke, COPD, LR infections, LRTI, Alzheimer's and dementia, trachea and bronchus and lung cancers, diabetes. India obviously is going to become the diabetes capital of the world. We all know that, increasing obesity, kidney disorders, etc. And as per the WHO, aging has been defined here because it's geriatrics. We have to first study what does this science say about aging, and then we'll discuss about Ayurveda's aging. Aging is defined as a progressive and generalized impairment of functions, resulting in loss of adaptive response to stress and in growing risk of age-associated disease. And aging is any change in an organism over time. Aging refers to multidimensional process of physical, psychological, and social change. So all three things change because the body changes, there will be wrinkles, there will be graying of hair, there will be vision defect, hearing defect, weakness, etc. Psychological, they will be feel that they will be rejected and dejected in society, loneliness, lack of care, lack of love, sleeplessness, anxiety, depression, all these things will be psychological. And obviously social also, their lifestyle will change in the society. Some dimensions of aging grow and expand over time, while others decline. What I say grow, wisdom grows, definitely. A person's wisdom definitely grows. And we have two things in modern science, that is chronological age and biological age. There's a disturbance, I think, organizers. Can you mute all?
सभी सभी श्रोतागणों से मैं कहना चाहूंगा कि सभी लोग कृपया करके अपने माइक बंद कर ले, डिस्टरबेंस हो रहा है, काइंडली लिसन टू मी, सभी लोग अपने माइक बंद कर ले।
Okay, anyways, there are two things of age, that is chronological age and biological age. So what is chronology? It means the number of years. How long you have lived is called as chronological age. And biological age, does it match with the number of years? That is called as how old your body looks like. These two are the types of ages or ages. This is now the most commonly postulated theory in modern science. Let us throw some light before the come to the Ayurveda, contemporary Ayurveda. We'll go with the contemporary science, the present one. That is the most commonly postulated science is the free radical theory of aging. We all know that day by day, every day in our metabolism and digestion, we accumulate some changes in the body, and there is a release of free radicals, and they are very highly reactive. And these changes induced by the free radicals are believed to be a major cause of aging. Because whenever there is an oxidative stress, free radical damage, then definitely the aging process will be fastened. This is a concept there. And how do these free radicals are generated? Obviously, it is by the sun's rays, especially between the mid sun, that is in the mid afternoon. The morning and the evening sun is a richer source of vitamin D. That's why it cannot increase the free radicals at that time. But from noon to the forenoon to afternoon, that is little bit of 11 to 3, 4, like that, the very scorching heat may increase the free radicals. Pollutants, obviously, because we've seen a huge number of growths of industrialization, deforestation, so much of vehicles, heavy vehicles, etc. So all these pollutions are there, burning plastic, all these things are there. No any recycling, smoke, toxic chemicals, obviously, drugs, and diet. You don't have a healthy diet these years. That's why these are all the causes for the free radicals. What is this free radical? Atom and molecule with one or more unpaired electron is called as a free radical. And these are called as ROS, reactive oxygen species. Those are superoxide radical, that is O2, hydrogen peroxide, which we all know, that is H2O2, hydroxy radical, that is OH.
You are mute, sir.
Sir, you are muted.
सर सो सॉरी टू इंटरप्ट यू सर, म्यूट हो गया है शायद आपका माइक, प्लीज चेक कर लीजिए। जी जी सर, अभी बोलिए सर, एक बार बोलिए सर।
Okay, again full screen.
जी जी सर, आ रही है, आपकी आवाज आ रही है, बिल्कुल आ रही है।
Yeah. Okay. So these free radicals, all these three, they will be very eagerly waiting for to be oxidized. They are unpaired electrons. They are not saturated. They don't have a partner. Hence, this cell damage occurs. The cell damage is caused by the free radicals, naturally occurring metabolic byproducts by strong oxidating agents. They are highly reactive. They are cytotoxic. They are definitely toxic for the cells of the body, and they are very unstable and short lasting. Now, free radicals, the research says that they may damage the DNA, they may oxidize the fatty acids and main constituents of cell membranes, beneficial effects in phagocytosis and immune system. All these damages the beneficial effects of phagocytosis, they damage the oxidative fatty acids, and also they damage the DNA. Now, this is a free radical, and it's a concept of my gurus in Jamnagar, as well as I've heard some people, teachers speaking, and I also try to analyze this one in the concept of Ama, because in Madhukosha commentary of Madhav Nidana, chapter number 25, that is Amavata, beautifully, Ama has been differentiated into three varieties. Even though we know that Ushmano Alpabalatvena, Dhatu Madhyam Apachitam, Dushtam Amashagatam Rasam Mamam Prachakshate is one universal concept which we all have studied in the UG and PG. But Madhukoshakara throws a very beautiful shloka, Amam Andarasam Kechit, Kechittu Malasanchayam, Pratamam Dosha Dushtim Kechit Damam Prachakshate. So Amam Andarasam Kechit. This makes Ushmana Balatvena fine. Kechittu Malasanchayam, this is very important. Whenever there is a digestion metabolism, the Pachana Kriya or the Dhatu Poshan Nyayas, the Upachaya and Apachaya takes place in the body, then obviously we know that there will be release of both Sara and Kita. The Sara is utilized for nourishment of the Dhatus as well as the giving energy, Bala, Varna, etc. for the body. And the Kitta is called as Mala. If this Kitta is not thrown out in the form of Dhatu Malas as well as Sharirika Malas like Sweda, Mala, Mutra, then there will be Sanchaya of the Malas. That Sanchaya is also called as Ama. And obviously, these free radicals are nothing but the metabolic wastes, which are free electrons eagerly waiting for to be oxidized. Wherever they are oxidized, they cause oxidative stress and lead to the damage of the body. That process is called as free radical damage. And lastly, Madhukoshakara says that Pratamam dosha dushtim kechidamam prachakshate. The first stage of dosha dushti that takes place, you may call it a sanchayavastha, you may call it the initial yatha dushtena doshena after samprapti. So whatever dosha dushti that occurs because of the collection of ama in the body can also be called as ama. So here if you see the comparison of the stable molecule and the missing electron. The blue one is a stable molecule because if we say in the nucleus, we know that in the nucleus there is protons and neutrons. The number of protons, if it is equal to the number of electrons, then it is a stable molecule. Whereas if the number of protons are more or less, actually it's less, and one electron is more and is not having a partner, then this electron is free to move anywhere in search of the partner. That is called as free radical. And this occurs as an oxidative stress. Whenever there is a normal cell, it is healthy, fine, competent. when there is a free radical attacking the cell, you can see the cell damage what has happened. Because the free radicals are not neutralized by the protons, they will be eagerly waiting. They are negatively charged. They are eagerly waiting for the oxidation, and wherever they find the place, there they go for free radical attacking the cell. And with the cell, there is oxidative stress. The cell is completely damaged in the third picture. Let me go back. Please listen carefully. If at all somebody is a UG student or a PG scholar, this is my understanding of this radical damage of Ayurveda, that this electron missing a partner. There is no partner for this for stabilization because here it is same. Now this electron, which is a free radical, is angry because it doesn't have a partner to neutralize. When it is angry, this gets detached from the orbit and it starts circulating all over the body in search of the partner for stabilization, that means an oxidation, which leads to the damage of the oxidative stress. Angry electron circulating all over the body to find a match, to find a partner for stabilization or neutralization. And wherever it finds a partner for neutralization, there it causes cell damage because of oxidative stress, and that leads to the formation of diseases. If we say this, our students of BMS and MD will be fascinated how beautiful modern science is. An angry electron circulating all over the body, trying to search in a partner, wherever it finds a partner, settles down there, causes oxidative stress, cell damage, disease. But my dear friends, please look at this shloka. I said angry electron because it doesn't have a partner. Kupitanami doshanam. Angry word is used there also. It is kupita. And it is a dosha because it's not stabilized. It is angry. And it is circulating all over the body. Sharire paridhavatam. When it is Sharire paridhavatam, why it is Sharire paridhavatam? Because it is in search of the partner. Yatra sangaha. See, wherever it finds an oxidation partner, there ka vaigunyat, that particular Shotadrushti takes place and leads to the Vyadis Tatropajayate. So we are all ignorant that our science has already done PhD. No any other science in the world has given such a beautiful explanation in a coded form, which the Uttam Buddhi Shishya should decode it and try to understand in the modern parlance, because we are living in the 21st century where we have to answer people, especially I always call, because many students might have attended my Charakayatana classes, I call them as Google patients. Nowadays, they are Google patients. That's why you have to talk them in their own language, but you have to always keep the wisdom of Ayurveda with you so that you can assess the concept of this free radical stress and oxidative stress. So this is the beauty of Ayurveda, that it has told everything, but in a language which the world didn't understand. If the world would have understood the language of what Ayurveda has written today, we would have been ruling the world, because everything is there. So this, whenever there is a, see, this minus of electron, and when it is paired with the blue and green, then the free radical and an antioxidant together will stabilize the free radical. That is why antioxidants, forget it, it's a modern word. I say rasayanas, I say vayasthapakas, I say hrudya, I say tiktarasa shotoshodaka, malanisaraka, whatever it is, all these wonderful rasayanas, what we have, including amlaki, haritaki, guduchi, etc., are all antioxidants as per the modern concept. And these will definitely neutralize the free radicals so that there will be no damage to the body. Neutralization is very important. Coming to Ayurvedic way of aging, we all know that there are Swabhavika Vyadhis in Ayurveda. In Sushruta Sutra also it is told, in Charaka Sharira also it is told. That is, Kalasya Parinamena Jara Mrityu Nimittajaha Roga Swabhavika Drushta Swabhavo Nishpratikriyaha. Clearly, Charaka Acharya says that Swabhavika Vyadhis are Nishpratikriya, you cannot treat. Then Sushruta says, Swabhavikastu Kshut, Pipasa, Jara, aging comes here. Geriatrics comes here. It is inevitable consequence. It cannot be prevented. It's a Sabhaka Vyadi. Mrityu, Nidra, Prakriti, Prutyaha. So these are all Prakritika Vyadis, Swabhavika Vyadis, including Shuddha Pipasa. Why? Because if you drink water, the thirst will not be subsided for long life, entire long life. You have to drink it again and again. Shuddha also same thing. If you eat once, it is not like your hunger is satiated till the end of life. Nothing like that. So these are all, even Nidra, Mrityu are all Swabhavika Vyadis. And this Kala Parinamana is not at all curable. Nishpratikriyaha. So this shloka we all know is from Vimanasthana chapter 8 in the Shivda Pariksha, the last Pariksha, that is Vaya Pariksha. There beautifully the Jara has been defined by Charakacharya as Ataha Param, Shashti Param, because the previous shloka ends with Ashashti, 60 years. Next shloka starts Ataha Param, after 60. Kiyamana means Kshiyamana, gradually deteriorating. Dhatu, Indriya, Bala, Virya, Paurusha, Parakrama. All these will be gradually deteriorating. Dhatus will be gone, Indriya, Bala will be gone, Virya, that is potency, the enthusiasm will be reduced gradually, Paurusha is reduced gradually, Parakrama is reduced gradually. Coming to the mental functions, Grahana, grasping, Dharana, retention, Smarana, recalling. So these are all the higher mental functions. First, we will grasp, then we will hold, then we will recall. That's why Grahana, Dharana, Smarana. Smarana is not memory, my dear friends. Smarana is recalling power. Memory is to hold, but recalling. If you remember it till the exam, but on the day of Viva, if you are not able to recall, it's absolutely waste. That's why your Rasayana should be having all the potential capacity of Grahana, Dharana, and Smarana. And obviously, Vachana, there may be slurred speech, they may be very less talkative, or they may sometimes talk irrelevant if at all they are the patients of dementia, Alzheimer's, etc. And Vijnana is the Shastrantara Jnana, or it is the Vishesha Jnana. That all be, they cannot learn new things. In Jara, they cannot learn new things. But whatever they have learned, the wisdom expands, but the new things cannot be learned. Next he says, Brahshamana Dhatu Gunam. Even the Dhatu Gunas like Prinana, Jivana, Lepa, etc. will be Brahshamana. The Asti becomes Kshina, no Dharana. That's why they need a walking stick for Dharana. Vayu Dhatu Pramyam. See, they say Vayu Dhatu, not Dosha. Because in old age, Vata physiologically increases. This is very important. Vata, Pitta, Kapha in their physiological state are called as Dhatus. Rasatu, Shukra, if they are vitiated, they are called as doshas. And malas also, Avastambaha Purishasya, Mutrasya Kleda Vahanam, and Svedastu Kleda Vidriti, they are also doing the dharana of the body. But Vikrita malas, Vikrita doshas, and Vikrita dhatus, all three can be called as malas and doshas. But in old age, the vata is physiologically increased. That is why Vayu Dhatu Prayam. It is not pathological increase. It is not a vata vyadi. Jara doesn't come under the vata vyadi. It is a natural physiological increase of Vayu. That is why Vayu in old age is not dosha. It is dhatu. It is natural. Kramena Jirna Muchate Avarsha Shatam. So gradually when it happens, the people are called as Jirna and it is up to Avarsha Shatam. If you are interested, please read the next sloka and also the commentary. You will enjoy it. That 100 years was taken as the mean at that time. Somebody may be unlucky enough to die within 100, that is up to 70, 80, and somebody may be very blessed to live more than 100 also is told in the Charak Samhita only. And at that time, the 30, 60 and above 100, these three varieties, Bala, Yuva and Vruddha should be done based on the average lifespan. If it is 120, divide them equal into 3. If it is 100, divide into 30, 60 and 70. That is out of the syllabus, so I'll not talk. But Acharya Shushruta definitely says 10 years more. Compared to Charaka, Acharya Shushruta says aging starts at the age of 70. Now, Even though directly there is nowhere mention of these two words in Charak Samhita or Sushruta Samhita, we can understand by the hidden meanings of the entire Acharya's description that Jara can be divided into two types. One is Kalaja and second one is Akalaja. Kalaja cannot be prevented because it is a Swabhavika Vyadhi. It is natural and physiological aging. Whereas Akalaja, nowadays all in your OPDs you can see children as young as maybe 10 years or 6 years, maybe having gray hair, okay, maybe having vision defects. They come with a very huge glasses of plus concave lenses, etc. So these are all early signs of aging are coming because of this lifestyle and unhealthy diet and lifestyle and pollution, etc. So Akala Jara is the very serious problem that we have to address these days. Kalaja is normal, Akalaja is abnormal. So I'll run fast here because there's a lot of things to be told in Chikitsa, geriatrics. Aging after 60 is natural. It is even occurs after following Sadvrutta, Dinacharya, Ritucharya. Because it to hona hi hai, this is all natural and it is of low intensity. Very important. This aging is low intensity, slowly progressive and not troublesome to the body. There is no cure, considered to be palliative, yapya, because yapana basti, yapyam yatnyana yapayeta, yapyam yatnyana yapayeta, with treatment like rasayana therapy, it can be done. But premature occurs before 60. I said as early as now 10 years also we are seeing it occurs due to improper following of personal hygiene and purification. No Rutu Shodhana, no Sadvrutta, no Dinacharya, no Rutucharya, no Ahara Vidhiya. We are not following the proper Nitya Sevaniya, Nitya Sevaniya Varja. Then it is of greater intensity. Premature aging is of greater intensity. It is rapidly progressive. It is manageable with rasayana drugs according to the dosha and accompanied of the disease or the stage of aging. So sometimes if it is disease, then it comes to Nimittaka Rasayana and stage of aging also matters what Rasayana to be given. Now, many of you might have come across this shloka from Sharangara and Vagbata, decade-wise aging concept is given. हर 10 साल में हम लोग क्या खोते हैं? What will we lose every 10 years of life? So, balyam vruddhischchavirmeda tvak drushtihi shukra vikramau buddhihi karmendriyam cheto jivitam dashato raset. So, considering 100 years, and go to the next slide, it can be easy. Ashtanga Sangraha considering it as 100 years, Sharangara considering 120 years, because 12th decade is 120 years, they have told the shloka that every 10 years we are losing. That is the first 10 years we are losing the balya. The second 10 years, that is up to 20, the growing stops, vriddhi stops. Third year, we will lose the luster of the skin, prabha. The complexion of the skin will lose, luster will lose. Fourth year, gradually, the medha, that is the sense of discrimination, sense of learning new things, medha, intellect, buddhi, we lose. Twacha becomes a little bit weak by the end of 50 years. We may find early signs of aging like some valley, that is the wrinkles on the skin, and skin may lose the elasticity like that. From the 6th decade, we lose our potency, that is Shukra. Then 7th decade, he says Akshi, 8th is Shruti, hearing, Manas is 9th, and 10th is Sarva Indriya. Similarly, Sharangara has increased it to Chetas, Jiva, etc. This is there in the shlokas, you can find it out. And what is the answer for this aging? Because we said aging cannot be prevented, it is natural consequence, it is a physiological, Swabhavika Vyadhi. So Rasayana, to some extent, will maintain conservatively to the yapan of the patients and can prevent the premature aging. Rasayana is made up of two words, rasa plus ayana. The word rasa may be anything else, ahar rasa, jiva rasa, like that, which is the nourishing potential vital force of our body. Ayana is a synonym of Shrotas, Patha, Panthana, Kha, Nadi, Sira, Dhamani, Ayana. Uttarayana, Dakshinayana, or also it is the route, traveling, walking, movement, road, path, way, progress, manner, etc. That are called as ayana. So the combined meaning will be that until and unless the ahar rasa or jiva rasa flows in all the srotases unobstructed, in all the channels, all the routes, all the path of the body, unobstructed, no yatra sangaha, no yatra sangaha. Those drugs which help for the rasa to move unobstructed in the ayanas is called as rasayana. That is the version of understanding rasayana word. Now, when we say rasayana, I've just taken an example of amlaki purposely because it is Vayasthapananam Sreshtam. And this is from Sushruta Sutrasthana, first chapter. Rasayanam Tantram Nama Vayasthapanam Ayurveda Balakaram Roga Parana Samarthyamsha. And Vayasthapana commentary Varshashatam Ayusthapanam. That means it is sure that you are living 100 years. If you live extra, it's bonus. But one thing is guaranteed that you are not going to die before 100 is the confidence of the Lana commentary. That is, if you take Rasayana, it is Vayasthapanam, Varshashatam, Ayu Sthapanam. Ayushkaram. See, next word is Ayushkaram. Shatadikam api karoti. Agar aap lucky ho, if this Rasayana has given you the Ayushkar effect, Shatadikam api karoti, it may increase your lifespan more than 100 also. Anyetu Vayasthapanam Jarapaharanam Tarunyam Bahukalam Sthapati Tyartaha. Some other acharyas say that Vayasthapana means it will do the apaharan of the jara and Bahukalam Tarunyam Sthapayati. Long time you look young. That is the concept of Dalhana's opinion about this commentary. And this shloka is also very famous. Rasayanam cha tadniyam yat jara vyadinasham. Thanks to Guru Nam Guru or C.P. Shuklaji in Jamnagar. I was listening to one of his lectures when I was a PhD scholar in Jamnagar. And this shloka, Guruji beautifully analyzed how to understand this Rasayanam Chatadniyam Vajjara Vadinashanam. It is Guruji's version which I am presenting in front of all of you. It Jara Vyadinashanam iti Jara Vyadinashanam iti Jara Nashanam Vyadinashanam Jarajanya Vyadinashanam. So these Rasayana Dravyas may do the Nashan of the Jara, may do the Nashan of the Vyadi like Naimittika Rasayana, and may destroy the geriatric disorders, which is our topic today. Jarajanya Vyadinashanam. Like that, Guruji used to analyze the shlokas. Such a great scholar today we are remembering. And but see what? Three exclamatory marks I have given. Just now we discussed that Swabhava is the Swabhavika Vyadi is Jara. And Swabhavo Nishpratikriyaha. Swabhavika Vyadis cannot be treated. Then why did that shloka say Jara Nashanam? So Jara Nashanam iti Akala Jara Nashanam. If we write a commentary on this shloka, we can write that Jara Nashanam iti Akala Jara Nashanam because Kala Jara cannot be treated. That is the proper understanding of the word Jara Nashana. Premature aging can be destroyed, not the mature aging. We all know this. Dirghamayu Smriti Medam Arogyam Tarunam Vayaha. All this we all know from Charaka Chikitsa 1, Rasayana Pada. So lastly line is important. That is Labho Payo hi Shastanam Rasadinam Rasayanam. The upayas made for the labha of gaining the prashasta rasadi dhatus is rasayana. No more simpler definition of this what I told right now. The meaning of the last line is all the upayas, all the measures you do to gain for the labha of best quality rasadi dhatus, prashasta rasadinam, is called as rasayana. It may be drug, it may be food, it may be achara, like achara rasayana. Vaksiddhi, the third line, is told as yaduchyate tadavashyam bhavati. If you have commentary with you right now, you can refer Charaka Chikitsa first pada. I think it is sloka number 7 and 8. वाक सिद्धि यद उच्चते तद अवश्यम भवति. रसायन जो लेते हैं प्रॉपरली वो जो भी बोलेंगे वो सच हो जाएगा. चक्रपाणी कमेंट्री. Commanding over the language, commanding over the speech, that is vak siddhi. Pranati, in the commentary again Chakrapani, loka vandyata, you will be respected in the world because you are so pompant, beautiful, handsome, glowing, strong, no signs of aging, all dhatus are nourished. That's why you'll be respected in the society. Pranati, loka vandyata in the commentary. So all these qualities we will gain by taking rasayana. This is Charakacharya's opinion, Koti Praveshika Vatadipika. And third one, which is not much taught in the classrooms, but it is very much important, but neglected nowadays, is Droni Praveshika, where Sushruta also says something about this. And in this concept, the entire body is vanished one day and the person recomes in that koshta, that is Droni, made up of palasha. It's less like a boat or a coffin. There is a new man coming out after 3 months, 6 months, like that. You have to read it in the fourth pada of Rasayana. And further Rasayanas are also aimed at therapy. That is 3 types of Rasayana: Kamya Rasayana, Naimittika Rasayana, and Ajasrika Rasayana. Kamya is again 3 types: Prana Kamya, Meda Kamya, and Sri Kamya. We all know this theory. Naimittikas are curative, particularly disease and immunity promoters. Use of rasayana, food, and other items for maintaining the day-to-day wear and tear are also called as naimittika rasayanas, like the Vardhamana Pipali, even Chavanprash has been told for some diseases, Palanam, Changavardhanam, Shwasa, Kasa, Ikka, all those diseases. So when you aim at a disease and give rasayana until the disease is cured, here the rasayana acts nimitta matra until the disease is cured. That is why the name is given as Naimittika. This is not Charaka's version, this is Sushruta's version of 3 types of rasayanas. And the last one is Ajasika Rasayana, Nityam Kshira Gritabhyasaha. Every day, if you are using Kshira and Grita in your food, that itself is the best rasayana, which is called as Ajasika Rasayana. Now coming to the next option, what is the aim of treatment? To counteract the vitiation of Vata during old age, to inhibit the tissue depletion, that is Dhatukshaya, and also to possess, to maintain the quality of precious dhatus, to enhance the bala, and also to promote the Jatragni and Dhatwagni Vyapara, including the Bhutagni Vyapara, digestion and metabolism. The preventive measures of premature aging are Samyak Ahara, Dinacharya Ritucharya, Adharaniya Vegas should be not Dharita, and Dharaniya Vegas should be held forcefully, which are Kaya, Vacha, Manasa. Preventive measures for premature aging is again Nityabhyanga, Nasya, Rutu Anusara Shodhana, followed by Rasayana Vajikarna. Refer 7th chapter of Sutrasthana, Navegan Dharani. At the end, he says about this type of Rutu Anusara Shodhana and followed by Rasayana Vajikarna, Naistiki Chikitsa, Achar Rasayana, suitable according to the suitable exercises according to, that is, I don't mean going to gym here. My meaning of exercise is keeping yourself physically active. That's all. Not going to gym and all. Danda Chatradharana, 5th chapter of Sutrasthana, just Skhalanartha, means prevent from falling. This is again found in one of the greatest books of Rasayana, written by the great Professor of Emeritus BHU, Vaidya Ramar Sinhaji. The mode of action of Rasayana has been schematically represented beautifully in 3 concepts of Rasa, Agni, and Shotas. In Rasa, Sir's version hypothetically, you may call hypothetically, but Guruji's understanding is nutrient value of plasma will increase. So once the nutrient value of plasma increase, it nourishes the Poshya dhatus, improvement of nourishment, improved qualities of dhatus, finally leads to longevity, immunity, mental competence. That is Jaranasha, Vyadinasha, Medavruddhi, and that leads to rejuvenation. My teacher, my PhD guide in Jamnagar, Professor H.M. Chandolaji, also using this shloka, this schematic presentation in his presentations. So this was apt for me today's presentation, so I have taken it from that book. Look at rasayanas acting on Agni. The damage done to the digestion and metabolism is corrected. Once digestion and metabolism is corrected, again there is nutritional improvement, finally followed by the same things. And coming to the Shrotas, the Anupravana, microchannels, microcirculation, tissue perfusion, all these concepts have been taken, again leading to the concept of longevity, immunity, mental competence, and rejuvenation. So in preventive geriatrics, this was a conference by CARI, which is again the branch of CCRS New Delhi in Bangalore. I attended as an expert. There was a concept of preventive geriatrics, where Rasayana Prayoga can be considered as the best Brahmastra for the preventive geriatrics. This inhibits tissue depletion, that is Dhatukshaya, and maintains the precious dhatus, counteract vitiation of Vata during old age, promote digestion and metabolism. Now, looking at some of the commonly used rasayanas for the health of heart. Because old age, we all see that there will be some diseases of the heart and circulatory system. This I want to clear first only that have been inspired by the concepts of Ayurveda as well as modern research, so that we can exist in this modern world and we can be competent enough for the other pathies that we can talk in their own language, also in the form of rasayana. I'm not completely throwing these concepts in the Western world, but understanding is important. So Arjuna, we have been told that Arjuna is Hrudya is different, Dadima is Hrudya is different, Draksha Hrudya is different. So Draksha Dadima may be antioxidants, but Arjuna is a very good tonic for the heart muscles. Ugulu Comifera Mukul is an excellent anti-atherosclerotic. That's why it is Kafahara, Medohara, Lekhana. See, I'm telling both the words. Kafahara, Medohara, Lekhana, Rasayana, Tridoshagna. That's why it is good for the atherosclerotic changes in the arteries. Pushkaramula, unfortunately, they are telling it as a very endangered species, but you can grow it because if you start using Pushkaramula, there is no work for the cardiologist to do. How can I say so confidently? Because Pushkaramula contains in the bottom of slide. Phillips OA, Matthew KT, Oreo MA, antihypertensive and vasodilator effect of methanolic and aqueous extract of Tribulus terrestris, Gokshura in rat models they have done and published in Journal of Ethnopharmacology 2006. That means Pushkaramula is not written in this article, but Gokshura is written in the article. And now let us understand in coronary artery disorders, not in coronary artery disorders, but congestive cardiac failures and other heart diseases where there is congestion, even modern doctors prescribe diuretics. In cardiac asthma, CCF, they prescribed diuretics. And Gokshura is Mutrala, Shotagna, one among the Dashmula. So we have to understand like this. There is a saponin in Gokshura, which is a coronary artery dilator. It's a vasodilator. Similarly, Pushkaramula, Inula racemosa, it is a bronchodilator as well as vasodilator. Shilajatu, if you get pure, it is a blessing because in our college only one work has been done on age-related arterial thickening. It is published in one of the great journals and done by a great physiologist, Professor Kushal Das, who is one among the 2% of Stanford scientists. He is working in BLD Medical College and we have BLD Ayurveda College. Thanks to this collaboration, Shilajatu work was done on arterial thickening and it was a wonderful results. And this was done that in the lab of vascular lab. They created this vasculars, that's arteries in the lab. They kept it alive by creating the environment. We have a very good vascular lab here. And there this work was done where Shilajatu has proved very wonderful. And the patients taken were hypertension, the arterial thickening induced hypertension. Gokshura I told just now. Moving on to the heart again, Dadima. These are different cardiotonics because all are Amla Dravyas. If you see Hrudya Dashemani in Charak Samhita, all the 10 medicines told in Charak Samhita Sutrasthana 4, Apamarga Tanduli Adhyaya, sorry, Shadvirachana Shadrashti Adhyaya, are all sour in taste. And no wonder why there is so much of demand for the black raisins, dadima, amla, and mango fruit here. Because when it comes to diabetes, mango seed, but here is a fruit. They're all hrudya because I say they are free radical scavenging, they are adaptogenic, they are high richest source of vitamin C, hence they are best antioxidants. These are the references I have put for the proof of modern research articles done on pomegranate juice. Ischemic heart disease, oxidative stress following ischemia perfusion injury cause lipid peroxidation in lipoproteins and arterial macrophages. So in the double-blind study, 15 patients with carotid artery stenosis, consumption of PJ is nothing but pomegranate juice, reduced systolic BP and carotid intima media thickness, which was attributed to the antioxidant activity. That's what I told. Then further, this is 240 ml of pomegranate juice every day for 3 months. 45 patients of CVD, CHD, coronary artery disease, myocardial ischemia was repeated in randomized double-blind study, placebo-controlled. So this is the reference I have given, published in 2021. Based on the above data, we can say that antioxidant features of pomegranate juice extract contributed to its robust protective effects against coronary heart disease. So dadima as a hrudya can be proved. Coming to grapes. Friends, whenever we talk about grapes in Ayurveda, it should be dark grapes, like purple, black, blue. Okay, not the regular green varieties, because they don't have such a cardiotonic in them, but these have more. That's why here in grapes are just source of bioactive molecules which contribute to health benefits. And those are, see, the bioactive phytochemicals in the grapes include phenolic compounds such as hydroxycinnamic acid, anthocyanins, proanthocyanidins, and stilbenes. And this also article published in the year 2021. I have given the reference. They are having the potential function reducing hypertension. And they also reduce the risk factor of cardiovascular diseases. Common vascular disorders related to CVS are atherosclerosis, hypertension, congestive cardiac failure, other chronic conditions like needing integrated conservative management, and the drugs on the right hand side I have given Shilajatu, Lashuna, Sarpagandha, Arjuna, Arjunarishta, Shirapaka, Prabhakaravati, Gugulu Kalpas, and Pushkar Mulasava are very good for these conditions. Coming to the brain, thank God that we are using Haridra. You cannot find Haridra as a major rasayana in major samhitas. But look at this article. Curcumin inhibits the accumulation of destructive beta amyloids, which are the major cause for Alzheimer's, in patient's brain and breaks up the existing plaques. Low molecular weight of curcumin and polar structure of curcumin allow it to penetrate the BBB. Very important. Our grandmothers and mothers were very intelligent. They always used to give milk with curcumin. That is haldi. दूध हमेशा हल्दी के साथ मिक्स करके देते थे. So kshiram mine estimatu medya rasayana. See, take the clue from there. Charaka Chikitsa, first chapter, third pada. Kshireni estimatu kasyacha. Kshira is told there. Medya rasayana. And why not kshira here for haldi? Maybe the lactoproteins, the lactose, and the other things of the Jivani effect of the kshira may enhance the piercing of curcumin through BBB. And no doubt about Shankpushpi, Mandukparni, Brahmi, Vacha, these all we know, but only researchers I'm telling here. See about Brahmi, lots of articles I've given the reference of 1991 and 1999. Brahmi is free radical scavenging, enhances cognitive functions. Clearly, they have mentioned it enhances the cognitive functions. It is anti-epileptic. Work done by the modern doctors, anti-epileptic, sedative, anti-anxiety. This is about Brahmi. Look at the, again, continuation of Brahmi only. Central Asiatica, anti-cancer anabolic activity. Another articles published by Appa Rao MBR ETL, Indian Journal of Psychiatry in 1969-77, Gupta YK and others, Pharmacological Biochemistry Behavior 2003, and Sairam K in 2001, all say that anti-cancer and anabolic activity. Look at ashwagandha, how many wonderful these things have. Again, I'm telling you that please don't misunderstand me that I am telling that Ayurveda drugs will act on these parameters. Nowhere. Ayurvedic drugs acts upon rasa guna viryapaka, but just I'm enhancing the moral of the young doctors sitting here that you may also think in this way to answer the modern world that our Ayurvedic drugs are having so much of potential chemical compositions, which in your language also can be demarcated or understood as anti-Alzheimer's, anti-schizophrenia, dyslexia, depression, etc., for ashwagandha. All actions on ashwagandha, again it's the best adaptogenic. That's why ashwagandha is used for all mental disorders because the person gets adapted to the situations. Immunomodulatory effect, cardioprotective, anti-inflammatory, anxiolytic, and neuroprotective. All these activities. Now, our Guruji in Jamnagar used to tell that Japanese have found this methylphenidate 4 can regenerate the dead brain cells, neurons in the brain. That's why it is anti-Alzheimer's also. Common disorders of Jara in aging are anidrata, insomnia, उनको नींद नहीं लगेगी, dementia, forgetfulness, Alzheimer's, anxiety, depression, and the failure of cognition. They may not identify the things. So the best solution for them for anidrata is tagara churna with maisha dugdha, because maisha dugdha, buffalo milk, is nidra jananam. It will cause more sleep. It has some role to play with serotonin. And tagara churna is also, we are giving it and finding results in our patients. Brahmivati, Ashwagandha Valeha, Brahmigruta, Kalyanaka Gruta, Mahakalyanaka, and Saraswatarishta are wonderful in all these conditions of brain-related pathology of aging. Along with that, I have written at the bottom, assisted by spiritual, philosophical counseling, yoga, pranayama, and meditation, because that will help. Adravi Bhuta Chikitsa also helps in psychological disorders. Coming to respiratory tract, again, Haridra is Haridra Khanda, Vasa, a best bronchodilator, mucolytic, etc. Yestimadu, Kantya, Swarya, Shirisha, Shrestha Vishagna, and modern research says that Albizia lebec, Shirisha, is a best antihistamine. The Tok of Shirisha is best antihistamine. That's why all these respiratory tract infections are more of histamine release, allergic bronchitis, allergic rhinitis, COPD, asthma, these conditions of Vasavaleha, Haridrakhanda, Estimadu Rasayana or Estimadu Churna with honey, Shirisha Tokkwata, tea made up of Shirita bark, excellent antihistaminic activity. Along with that, you can go with Kanakasava, Tulsi, etc. That can be understood by yourself. For respiratory, again, Pushkarmula, just now I told bronchodilator, Pippali, Rasayana, and Kantakari, Xanthocarpine of this one, Kantakari, is very good for bronchodilator. Tulsi, just now I told. Now, common disorders I told, rhinitis, bronchitis, Shwasakasa, Chavanprash, Haridrakanta, Agastharitaki, Chittaharitaki, Talisadi Sidopal are there, Kanakasava I told, Vasakasava and Pushkarmulasava. Coming to digestive system, these three drugs, Amlaki, Brangaraj, and Shatavari. About Amlaki, n number of drugs, n number of research articles like antioxidant, cardioprotective, increases the free radical scavenging, enzyme catalase and superoxidase dismutase, hepatoprotective, immunomodulatory, anti-aging, published in 1999. Anti-aging. Again, for digestive system, if there is loose motion, use Kutaja and Vilva. If there is constipation, please use Haritaki. We can understand this. This is one area where we can command on any other subject of modern science or any other science in the world is liver disorders. Look at the drugs. Philanthus neruri, Rumyamlaki, Pippali, Kalamega, Katuki, and Guduchi. You can find a number of publications by modern pharmacologists that these drugs are hepatocellular regenerators. I have a number of patients. Today is not about Kamala, but I have spoken in Charakayatan about Kamala, shown success stories with all this, even bilirubin up to 37 have come down with Patolakatrana, the Arogyavardhini, etc. So these are the blessing for Ayurveda that we are the masters of liver disorders management in the world. All this Patolakatrunadi, Falatrikadi, Bunimbadi, Arogyavardhini Vati, Vasa Guduchadi Kashaya, Kumar Yasava, and there are many others, you can name it. Yeah, Guduchi, you have hypoglycemic, anti-inflammatory, anti-cancer, anti-allergic. Plus for the pancreas, whenever I say pancreas, I am talking about prameha. So I always say, unfortunately, some people are selling jamun fruit juice, saying it is anti-diabetic. Very blunder mistake. The anti-diabetic property of jamun seeds, jambu, is in the seeds. I told seeds. If we give the juice of the pulp, definitely we are doing injustice to the patient. Tejapatra, one of the ingredient of madhvasava in Charaka Chikitsa, Pramayadika. Karavelaka, again, potent activity is in the seed. This is the glass made up of Vijayasara Asana. You can see the wooden glass made up of Asana, Vijayasara. This is used in some people of North India where they will put the water in this glass overnight, and in the morning the water color will change to straw or little bit mild amber color, yellow color, and they will drink it empty stomach for diabetes. Asana, Pterocarpus marsupium, if you want to know the antidiabetic activity, is present in the epicatechin, which is the active principle. But asana is Vijayasara, Bijaka is well explained in Charak Samhita for Santarpanata Vikaras like Kusht and Prameha. So if anybody asks you how asana is anti-diabetic, you can tell them that epicatechin, but please don't extract epicatechin from asana. If you extract just epicatechin and give in a form of capsule, it has side effects. But if you give asanadigana, asana as a whole, no side effect. That's why we should not play with the nature. Chiraita, etc. Many antidiabetics are there. So Amra Bija also, Jambu Amrasti, Haridra, Nishamalaki, all this came here. Methi, seeds. N number of medicines you can get in textbooks prescribing for Prameha and Madhumeha. Coming to the urinary tract, the word itself is Punarnava, Punaha Punaha Nava. Please try to find out a monograph on Punarnava. The name is Kidney and its Regeneration, written by BHU in early 1960s. There they have claimed that a proper use of Bohirivia diffusa, you should get the proper Punarnava, not the other variety. It has the capacity to regenerate nephrons. That's why Punarnava, Gokshura, Varuna, Kulatha, Ikshu, Runapanchamula, all these wonderful drugs we have for the urinary tract. Pashana Vedadi Kashaya, Pashana Vedadi Churna, Runapanchamula Kashaya, Shilajatu, all these things are there for the urinary tract infections like BPH, Mutrakritra, Mutragatha, cystitis like Ushnavata, all these conditions including Shmari. Now after aging, there is less role for sexual health. But premature, if there is aging, then if you have some infertility cases, use Kapikachu, Ashwagandha or Musli. In women, Shatavari, Ashoka and Japapushpa used for female reproductive health. All these we know, Ashoka Arista Lodrasava, Kumaryasava, Musli Paka for men, Vanadikalpa, Ashwagandha Valeha, Rasayana for men, Ashoka Arista Lodrasava, Kumaryasava for women. As the time has crossed 4:30, we are coming to the end of the last slides. Role of Sattvaji Chikitsa in aging. It's very important because people who age, they need more of a mental support. They need psychological counseling. In today's nuclear family, they all feel lonely, rejected, and dejected in the society. They have experienced everything in life, but they want to spend their last time with their beloved ones. Please engage them in some spiritual, philosophical activities. Let us keep them socially active. Advise them to chase the dreams of passion of their hobby. Tell them, please do what you love. Don't sit idle. Empty brain is devil's workshop. The love and care of the family members are very much important. See the last one with the golden bold letters I have written. The best therapy for the geriatrics is to be with their grandchildren. For those people who say Ayurveda is not science, I can say that the most scientific science in the world is Ayurveda, because if grandparents are with the grandchildren, it is neutralizing Vata by Kapha, because old age is Vata age and children's age is Kapha age. Please look at the gunas. Tatta ruksho lagu shitaha kara sukshmashtaranilaha. Snigdha shito gurur mandaha slakshna mrutsna stiraha kapha. Exactly opposite. All the qualities are exactly opposite except Shita. So this is naturally overcoming the Vata Lakshanas by Kapha. So I further say that when they play, when the grandparents are lying down on the bed and the grandchildren are jumping on them, beating them with their hands, or even stampeding them, पैरों से उनके ऊपर थोड़ा उछल कूद रहे हैं, बच्चे स्निग्ध है, तो वातस्य उपक्रमः स्नेह स्वेदः संशोधन मृदु, इट्स अभ्यंग मर्दन पादाघात चिकित्सा. आप केरलीय पंचकर्म में जाइए, पादाघात चिकित्सा. नेचुरली वात व्याधि सभी दूर हो जाएंगे. Psychologically they will be healthy. So in a nutshell, I want to say that Jara is an inevitable physiological consequence of aging. Natural aging cannot be prevented. Rasayana can improve the quality of life in elderly. Rasayana has all the components to rejuvenate, build physiology in a consistent manner, so long as it an integral part of one's life, integrating with Aushadha, Ahara, and Achara. Old age is not the exact time of Vayasthapana. Please mark this. No concept of युद्ध काले शस्त्राभ्यास. एजिंग होने के बाद रसायन लेने का कोई यूज नहीं है, बिकॉज आचार्य टोल्ड दैट पूर्वे वयसी मध्ये वा. रसायन शुड बी टेकन as early as possible. Purve vayasi madhye va, to prevent the aging. This is the last slide. It is my concept. I understood like this. I always say to the children that when they bring their parents, old parents to my OPD, I tell them, don't make them irritated. Don't hate them. Old age is like a new childhood. So the goal of geriatric care should be care rather than cure. Application of Ayurvedic Rasayana in geriatrics can be definitely bring back the smiles on the face of elderly. And finally, the great saint who rejected Padma Shri and Padma Bhushana from Modi ji, His Holiness Sri Siddheshwar Swami ji. I have taken this photo because I belong to the great city of Vijaypur, where his ashram is there. He is a great man, doesn't have any pocket to the shirts. He is completely Vairagya. He rejected all the worldly pleasures and awards from the government of India, happily with the folded hands that I don't want any recognition. He says, what is real wealth? A happy and healthy life, which lives to bring back the smiles on others' face, is called as health. And thank you very much for patient listening. And I again thank RAV for giving me this wonderful opportunity to express my views on geriatric care in Ayurveda. Thank you very much. Over to the organizers, please.
बहुत बहुत धन्यवाद सर. अब मैं सभी सम्मानित श्रोतागणों से आग्रह करूंगा कि यदि इन्हें इस विषय पर कोई भी संदेह हो तो क्रमिक रूप से एक एक करके सर से पूछ सकते हैं.
संजय जी बहुत बहुत आपको धन्यवाद, बहुत बहुत बधाई. आपने अवस्थानुसार विस्तृत ढंग से जो लोगों के अनुसार रसायनों का, वनस्पतियों का, द्रव्यों का जो सुंदर चित्रण किया, सुंदर वर्णन किया, वो बहुत ही प्रेरणादायक है, बहुत ही अनुकरणीय है। बच्चे बड़ी उससे जो है प्रसन्न हुए सुन करके। इसके लिए आपको बहुत बहुत बधाई और धन्यवाद। विभिन्न द्रव्यों का जो अवस्था के अनुसार आपने विश्लेषण किया वो बहुत ही अद्भुत है और मैं आपको बधाई देता हूँ। कोई ऐसा प्रश्न नहीं है जो पूछा जा सके, क्योंकि रोगानुसार कोई ऐसी आप चिकित्सा नहीं थी, अवस्थानुसार आपने हर द्रव्यों का वर्णन किया है जो अपने में एक बहुत ही अद्भुत है। धन्यवाद।
धन्यवाद सर, थैंक यू सर।
Thank you very much, Sanjay ji. It's a very excellent compilation and very expressive, and interpretation is very nice. Only just I wish to share regarding regeneration of the hepatic cells.
Yes sir.
To my knowledge, I felt Sharapunka is the best drug. That is what I felt. The Sharapunka is missing with your description. That's it.
Yeah, Sharapunka almost it is also hepatocellular regenerator, but most of the time Sharapunka is used for splenic disorders as well as the Sharapunka Asava is not available nowadays. But other than that, the commonly available drugs I have taken so that it's easy for the practitioner like Bhumamlaki, Kumari, Guduchi, etc. I don't say that Sharapunka is not good, but Sharapunka and the one more we commonly use in hepatomegaly and splenomegaly is Rohitakarist. Rohitaka is also one more drug which is very good for both spleen and liver. Sharapunka definitely can be added, not an issue, sir.
I'm not finding any lacuna with your, but it is my experience. There is a genetic disorder, hepatocellular degeneration. There is a degeneration disorder. It is because of the genetic abnormality, and in which I practically study.
Yes, sir. Agreed, sir. Thank you very much for the inputs.
रोहित का यकृत वृद्धि में, तिल्ली की वृद्धि में इसकी बड़ी अच्छी भूमिका है। लीवर के लिए जो लीवर सोराइसिस है, लीवर किडनी, बहुत अच्छी भूमिका है रोहित का की। तो एंटी कैंसर भी है रोहित का, तो इसकी छाल जो है एंटी कैंसर बड़े अच्छा प्रयोग करती है रोहित का को। तो रोहित का के बड़े अच्छे रिजल्ट हैं जो आपने बताया, हम यूज करते हैं रोहित का को।
जी सर।
किडनी की, आंतों की, लीवर की सूजन को भी खत्म करता है, कॉन्स्टिपेशन भी खत्म करता है। शरपुंखा भी अपने में अद्भुत है। शरपुंखा का प्रयोग बहुत अच्छा बताया आपने।
यस सर।
Hello.
Yes sir.
संजय जी कोई
Just a minute, sir. Just
एक मिनट
sir.
संजय जी अच्छा आप बोल लीजिए।
Excuse me, may I continue? Hello.
Yes sir, please continue.
See, in old age, after the age of 60, the most commonest problem is the benign prostatic hypertrophy.
Yes sir.
According to modern science, and it's a practical problem. With this regard, I didn't find any remedy in your presentation.
I had presented, sir. Please see the last slides. I had made about a presentation on BPH. I'll show you. There are some drugs like Varuna, Shilajatu I had mentioned. And along with that, if you want some patent medicines also, there are good medicines for like Bangshil is there, Himplasia is there, Prostina is there, where we concept is the Shota, the Shmula. Yeah, here are the drugs for, see, I had mentioned about the Koksharai Gukulu, Varunadi Kashaya, Chandravarti. And I told orally about BPH.
Okay.
Here it is, the Mutragata BPH. You can see on the slide.
Okay. Thank you.
Second one.
Sorry for the missing. Okay.
Yeah, no problem, sir. No problem.
बंगशील के साथ फोर्टेज भी दे सकते हैं क्या डॉक्टर साहब? बंगशील प्लस फोर्टेज एलार्सिन की, जो दोनों को मिलाकर के दे सकते हैं।
बंगशील के साथ कौन सा सर?
फोर्टेज
हाँ दे सकते सर, हाँ दे सकते हैं सर। वरुणादि कषाय, दशमूल कषाय, दशमूल कटुत्रयम कषाय, ये सभी जो है फर्स्ट एंड सेकेंड स्टेज में तो बहुत अच्छा है। और मेरे पर्सनल प्रैक्टिकल एक्सप्लेनेशन ये है कि दशमूल तैल का मात्रा बस्ती। अभी मैंने अपने ओन गुरु जो हमको द्रव्य गुण सिखाए थे, उनका एज 70 है, उन्हीं को बीपीएच हुआ था मेरे यूजी में, जिन्होंने मुझे द्रव्य गुण सिखाए थे। उनको हमने क्या किया, 40 ml ऑफ दशमूल तैला विथ 20 ml ऑफ क्षार तैला, दैट इज अपमार्ग क्षार तैला। प्लीज चेक द पीएच, वी आर नॉट इन चरकस एरा, वी आर इन द मॉडर्न एरा। अगर हमने कुछ गलती किया तो हमको कंज्यूमर कोर्ट में ले जाएगा, इसलिए हमने श्योर किया कि अपमार्ग क्षार तेल का पीएच थोड़ा ऑप्टिमम रहे, वेरी क्षार न रहे, इट्स नॉट बी वेरी अल्कलाइन। दैट इज व्हाई वी added 20 ml of अपमार्ग क्षार तैला along with 40 ml of दशमूल तैला, and believe me, it is giving very wonderful result, that the urgency and the dribbling of urine has reduced after the second sitting of basti for 8 days of matra basti every day. Is there any more inputs? Organizers, please.
Thank you so much, sir.
Yeah, today is my OPD. There are some patients waiting. That's why.
Bilkul, sir. Bilkul,
In
sir.
a hurry,
Thank you,
no
sir.
problem.
On behalf of the organizing committee, I would like to thank Dr. Sanjay M. Kadlimatti, sir, for delivering such enriching lecture. I would like to extend my sincere gratitude to our mentor, Vaidya Devendra Trigunaji, President, Governing Body RAV, for his continuous support, guidance, and blessings. I thank our director, Dr. Vanna Siroha ma'am, who is the guiding force for all the events at RAV. I would also like to thank Vaidya Rajesh Kotecha, sir, Secretary, Ministry of Ayush, for his participation and encouragement in all our endeavors. Most importantly, I would like to express heartfelt thanks to all the gurus, Sesh, and other scholars who, with their presence and active contribution, make this webinar a success story. Thank you to all. Namaskar.
Thank you very much. Please convey my regards to all the gurus, Vandana ma'am, Kotecha sir, Trigunaji. Because of them, we got the chance to share. Thank you very much.
Thank you so much. Thank you so much.
Yeah. Namaste.